Welcome and thank you for watching this video. How are you today? I'm Aline Ghijselings and I'm the project coordinator of CAVAsa. CAVAsa means the Center for General Welfare and the Flemish Pharmacist Network together. It's my pleasure to guide you through our project by answering the preset questions. But before doing this, I would like to thank the Flemish government, more specifically our Flemish Minister of Wellbeing, Hilde Krevits, as this project would not have been possible without their sponsorship. We know that many people experience psychosocial problems such as mental health problems, family problems, substance abuse or financial distress. However, not everyone seeks professional help, as some people may feel ashamed or do not know where to go with their problems. The pharmacist is an accessible health professional and may therefore be in a good position to recognize these patients who need psychosocial care. This is the main goal of Project CAVAsa. The project is an example of good practice of some Flemish community pharmacists taking up an active role in identifying patients with unmet psychosocial problems or to refer them to psychosocial healthcare. Even though there was a remarkable increase of family issues due to COVID and the lockdown situation, also psychosocial problems in more broader meaning of this term increased. We found it important that all these problems were covered with CAVAsa, so we trained the pharmacists appropriately. How are you doing today? In fact, it's a simple question asked several times a day by each community pharmacist in Flanders and beyond. A question with so much value and so much power, at least if you're able to really listen and feel what's really going on in the inside of the patients. This question is an opportunity to detect unmet psychosocial needs or to increase awareness of so many undiscovered health and welfare organizations available in the close community of the citizens. That's what we've been working on for the past 2 years with CAVAsa. This project connects community pharmacists to a local social work organization called CAW, which is a Flemish Center for General Welfare Work. It is an important player in patient well-being with a network of 11 regions, all over Flanders and Brussels. Each region has its own tailored care program based on the local reality. Let me also give you some background information so that you better understand the way healthcare is organized and connected to local authorities and social work organizations in Belgium. There are 60 so-called primary care zones, also named first-line zones, in Flanders and Brussels, established since mid-2020. A primary care zone is an area of 75,000 to 125,000 inhabitants and includes one or more municipalities. These zones have been set up to better coordinate the work of local authorities, welfare and care providers, citizens, informal carers and also volunteers. They have one common goal: to offer an effective and qualitative primary health care accessible to all with a central role for the citizens. Each primary care zone has its own care council and, not unimportant, there is a pharmacist seating in each care council. Pharmacists have an often underestimated important role to play in their local care network, but also in the global public health in Flanders and Belgium. Community pharmacists are perhaps a little too humble. They don't show enough that their job goes far beyond medication management only, as they are increasingly consultants for healthcare advice and they are often the persons of trust for their patients. They also take up a leading role in prevention programs like stop smoking, dementia, skin cancer, medication schedule, and so on. Community pharmacists are a solid primary healthcare unit in Belgium. They are locally embedded in the landscape. In July 2022, there were 4,656 pharmacies in Belgium. This is one pharmacy per 2,500 inhabitants. An important organization representing all these pharmacists is VAN, Vlaams Apothekersnetwerk. It is a Flemish network organization uniting several professional associations across all Flemish provinces. representing the pharmacist towards the Flemish government and partnering with all health and welfare care stakeholders. As a network, VAN stands for involvement, participation and open dialogue. Back to the scope of our project CAVAsa. It is conducted in Flanders, which is the northern region of Belgium, and wants to explore the role of the pharmacist in the detection and referral of unmet psychosocial needs. The study is running over 2 years and was set up in 2 phases. In March 2021, the project was presented to all 60 primary care zones. 9 zones showed interest in participating, and all of them were included during this phase. We were lucky that all these zones were well spread over the 7 Flemish provinces. The pharmacists seating in the care council of these 9 zones presented on their turn the project to all pharmacists belonging to their zone. For the second year, we've decided to expand geographically, growing from 9 to 35 primary care zones. If we take an average of 45 pharmacies per primary care zone in Flanders, we went from 405 to potentially 1,575 pharmacies giving access to the CAVAsa study material. Before the start of the study period, the participating pharmacists receive a mandatory training in which an introduction of psychosocial needs, conversation techniques and the correct way of referral are discussed during actual patient case studies. In the first year, this was a 4-hour webinar. In the second year, we've made an e-learning, easy accessible for pharmacists and their team members via a learning platform for pharmacists and with accreditation. To further support the pharmacist in the role, an awareness-raising poster was designed, informative patient leaflets were developed and an online registration system was set up. In the first phase, from October 21 until the end of January 22, pharmacists were asked to be extra alert for psychosocial problems and to detect unmet psychosocial needs of pharmacy visitors. When a pharmacist believed that their help was needed, they informed the patient about the project and the services of the social welfare organization. And a leaflet was discreetly handed over with information and contact details or other help options. If the patient was interested, the pharmacist arranged a referral to the social welfare organization, after which they contacted the patient within 7 working days. Referrals were done via the online page for professionals available on their website. Explicit verbal permission was always requested for referrals. The second phase is currently running since March this year. All will be finalized in January 2023. This means that today 221 pharmacists are registering all intervention in their daily practice linked to the CAVAsa study. During the first year, a total of 71 pharmacists agreed to participate. 7 online focus group discussions were organized with pharmacists to share their experiences with colleagues. A total of 79 patient contacts related to psychosocial well-being were registered during the first 4-month study phase. Mainly family problems, not linked to violence, and mental problems were registered. On the 3rd and the 4th place came financial problems and substance abuse. 10 patients were directly referred to the CAW. No data were collected on the follow-up care after the referral. If you're interested in all details, I would recommend you to read the entire paper submitted for publication in the International Journal of Pharmacy Practice, soon available. Or you can also download this paper via the on-screen link. As said, the second year only started in March 2022, and the e-learning had to be completed by mid-August. Today, we already have more than 40 patient contacts registered. The pharmacist stressed out that counseling for psychosocial problems does not fall within their area of expertise. but that the role in the detection and referral of these problems is valuable. Some pharmacists saw that this role is an extension in their regular work package. Others say that helping psychosocial vulnerable patients is already part of their job. Before the start of the project, they often felt unsure in dealing with psychosocial problems. Pharmacists found it helpful that because of the project, they had a better knowledge of psychosocial well-being and that they could refer patients directly to appropriate care. Another added value of this role is that it also raises awareness among the general public of the pharmacist as a full-fledged healthcare and well-being professional. In terms of detecting psychosocial vulnerable patients, most pharmacists felt confident. Starting a conversation about this topic seemed more difficult, and many indicated that they would only address the patient's problems if the patients asked for help. However, pharmacists noticed that patients generally appreciate it when a sensitive conversation is initiated, just because patients do not always dare to bring it up themselves. Pharmacists found it easier to start a conversation with well-known patients than with casual visitors. Domestic violence and financial problems were particularly difficult topics. The lack of time is a major barrier. The hectic study period, including COVID-19 and the flu season, played a particularly important role. As a result, the focus on psychosocial well-being sometimes shifted to the background, and interventions were not always registered on the online platform. Another barrier is that the pharmacy is a public space where full privacy is not guaranteed. If there are other patients in the pharmacy or in the queue, it is difficult to have a lengthy or sensitive conversation. A solution is to discuss this in a separate room, but this is not always possible due to staff shortage. In addition, some pharmacists fear that they are crossing the line when addressing psychosocial problems or feel that suggesting professional help may be experienced as stigmatizing the patient. Finally, some pharmacists said that they were alert for psychosocial needs at the beginning of the project, but that this diminished during the course of the project. We all know that the COVID-19 pandemic, the Ukrainian war and the energy crisis is contributing to increasing rates of not only mental illness but also other psychosocial needs. On the other hand, we note reduced availability of mental health care services because of the sudden increase in demand. These facts and many other underexploited opportunities in multidisciplinary bridging between healthcare and welfare organizations in Flanders are our engine to go further with this initiative. Starting to train Flemish pharmacists in taking appropriate action and making a difference to their patients on a daily basis. Their very high accessibility and solid relationship based on respect and trust with their patients are the perfect recipe for breaking taboos around psychosocial needs and increasing awareness about these problems and working on early detection and prevention. Because every person in need or vulnerable citizen in our society who finds its way to appropriate help through the pharmacist is worthwhile. We hope to get additional sponsorship after the second project year to further implement the insights and learning from this valuable initiative to all pharmacists in Flanders and turn it into a recognized and structural framework to become a sustainable practice. Before finishing this video, I would like to thank all pharmacists who've invested time and energy in this project, as well as all people involved from the CAW and VAN Network, and my project colleagues from Catholic University Leuven and University of Antwerp. Thank you for watching this video, and if you're interested in following us, or if you want more information, please contact me by mail or give me a phone call. Talk to you soon.